This lesson is devoted to visual analysis and its principles. We will look into several cases and we will try to understand how to use it and apply it and in which cases. And actually, it's one of the most difficult parts in the BioWell interpretation, and because you'll have to practice yourself, learn yourself, and the more scans you do, the more profound analysis you will be able to make. Let's go. Here we go. What is the essence of the visual analysis? Actually, this is the analysis that you should do yourself with your own eyes, and software doesn't help you at all. It's based on just comparing the emission real ones that you, for example, see on the right side with the breakthroughs and some blackouts and splashes that you see on the left side, for example. So the ideal emission is when the whole surface of the finger is starting from the highest intensity. If we go to the grayscale, we will see better maybe database here. And so at the border of the finger, the emission is having highest intensity, and then it slowly decreases and goes to zero. And see black, no emission anymore. So this is normal and ideal way when it is starting with maximum from the edge of the finger and slowly disappearing. Ideal. But then there are deviations from that. So visual analysis is made for this purpose, for your eyes to distinguish the ideal ones, like you see on this screen, with the not ideal one, with breakthroughs, gaps, splashes, etc. And I will try to explain you how to distinguish them. Well, first of all, just not to make some false positive, I've been pointing at that in previous lectures, that you can see this here. You see the gray lines like breakthroughs. These are just your papillary lines, the lines of your fingerprint. So it's not a problem. It's just the fingerprint visible. Depends on the finger. For some people, these lines are more visible on the BioWell scans and BioWell images, and for some people, they are not seen at all. So in case you see these regular linear gaps, these are not problems of the person with the organ system. This is just the fingerprint. Let's go. So the essence is that the ideal situation is what you see on the right side. See, left, front projection. So the thickness of the emission and the distribution of intensity inside of it is quite uniform and homogeneous. This is ideal. Then, actually, we have two more types of emission. Why it is so important also to take a look at the visual part? Because sometimes the parametric analysis doesn't work. I will try to demonstrate it. So just use black paper and we'll try to. So if we take a sector 1, sector 2, and in one case we have emission like this, and in second type we have something like this, smooth with spikes. And the idea is that in this case, from the point of view of parameters, the area, number of pixels, can be equal. Even intensity can be equal. And henceforth, the energy will be equal. And from point of view of parametric analysis, these two sectors are equal, absolutely. And by looking at the parameters, all these things that we have discussed earlier, going through tabs and pointing those going higher, lower, etc., parameters in some cases do not work, just because of the pattern of the emission. So this is why it's so important to actually, after doing the parametric analysis, also to do visual analysis and double check those things that you have pinpointed during the parametric analysis. Further on, take a look at the visual analysis, because some things will get approved. What you have mentioned in the parametric analysis, you will see also on the visual analysis. But some things you will see only during visual analysis, and parametric will not help. That's why it is so important to do both. They both give you information, parametric and visual analysis. So besides the ideal emission that you see on the right side, there are two more types. We distinguish them and we call them stress patterns and abnormal patterns. So the stress patterns, why do we distinguish them from the normal patterns? It's because stress patterns are temporary. You sleep well, you relax well, and they are gone. So this is a temporary condition. So for example, in here, in this case, lots of sectors with this, you see flares. This is just stress. Not so big stress, but still stress. We go to some other sectors, again, a little bit more breakthroughs, but when the emission is just cut into pieces like pizza in the direction from the center of the finger outside, we cut the pizza. This is a very good example here. This is stress pattern. Nothing abnormal, just stress. You see the flares, they are just cut into pieces. It means you take rest, you relax, and they will normalize and disappear. You just need to recover and just relax. These are the stress patterns. And we have a special atlas of types of images. Here you can see this screen, the number 1 and 2. These are ideal emissions. And starting from 3, you see small level of stress, hyperfunction. Then you see the average level of stress, bigger gaps, more flares, very big gaps. So high level of stress. So this is how it can look like. If you have 2 sweaty fingers, they are very wet. There can be almost no emission at all. And this is also stress. Can be physiological, but can be psychological. It's your job to define, looking at the chakras or nervous center stuff, first of all. So, but all these breakthroughs like pizza from the center going outside, like this cut, it's all fine. Just take rest. Temporary problem. But if we go further and we see these extra emission, we see on number 9, 10, 11, here in number 8, we see too much of the inner noise inside. This is inside the finger. It's also abnormal emission, so there's some kind of noise. Can be due to excessive electromagnetic fields influence or radioactive fields influence, or for women can be during the menstruation. It's excessive noise on some of the fingers. So we see this excessive emission here on 9, 10, 11, 12. We see not simply excessive, but we see a breakthrough. You see there is a space between the inner contour where the finger ends and where the emission should start potentially, but it doesn't start. There is almost no emission, or it's very low intensity. So this is some kind of old, maybe chronic problem with which your organism is already used to live with, and it's an abnormal emission. So there is a not breakthrough like pizza, but it's a breakthrough on the path of the light. So the light doesn't go smoothly from side of the finger outside till the end, but there are breakthroughs on the path of the light. So same as we see here, there is a breakthrough from the edge of the finger towards the end. Here we see these bright splashes, you see separated from the rest, separate bright lines, such porous cloud-like grape-shaped formations. Also you see a lot of breakthroughs on the path of the light, such standalone splashes that are separated alone from the overall emission. It's also abnormal. Well, I would say the most acute state maybe of these types of emissions, when these high intensity emissions is standalone. Well, actually this scan was made by me, and this woman had a tumor in one of her ovaries. And this scan was made 1 week before she had a surgical operation of removal of this tumor. And I have rescanned this finger many times, thinking that this is some kind of dirt on the surface of the glass, etc. And cleaning the finger, cleaning the glass, scanning many times, and it was always there. So such gaps, you see these scars. And also, this is a gap in emission on the path of the light. So how can you visualize it for yourself? What it is, these kind of emissions? If you imagine a car, our engine working normally, and you cannot even hear those phases of those cylinders working in the engine, it's all good. But when you hear and the car is working, so it's not smooth and homogeneous, it's oscillating too much, not enough, there are even fire going out from the pipe. So that's something wrong. So it means in the energy delivery system, in this particular sector, something is wrong. So it's not being homogeneous and constant through time, but there are peaks and lows, highs and lows, and it means that something is wrong there in that energy channel. So you can look for these abnormalities yourself. So for example, you can see here the breakthroughs on the path of the light from the inner part of the finger. So this kind of gap is abnormal. It's not a temporary thing like stress pattern. If we look here also, this is more like a grape-shaped pattern. Again, lots of breakthroughs and these standalone splashes. Again, not something new for this person, so you may pay attention and ask what's wrong in this sphere. You can see here it's the upper respiratory area, this area of the body. Well, actually in biowell system, there are sectors that are associated with multiple organs. And for example, here it's throat, larynx, trachea, and thyroid gland. So because the innervation, the information comes not from a specific organ, but from the area. Everything that is situated in this area leads and gives the information on the finger. And unfortunately, in biowell, we're not able to define which one exactly in this area is not working well by seeing such emission. It can be throat, it can be food tract, it can be thyroid gland, right? Because it's all situated here. That's why you have to be careful with giving some conclusions based on medical conclusions, based on biowell, but simply understanding that this area is being affected due to some reasons. So the main thing you need to find out, and you need to understand why it is like that, and give recommendations how to handle it. Because maybe this is all because of the incorrect positioning of the vertebra in this area that leads to the problems with innervation of this neck area, and that leads to such lesion here on the thumb finger. Let's look at some other cases. We have seen the ideal case. So once again, if you want to have in your library such an ideal case, just let me know. Send me a message, and I will send with your login name in the BioWell system, and I will send you this scan from my database that you can then further on show to other patients and clients, saying that this is not a cylinder, these are fingers, by the way, just I'm not cheating. So there are such people with such emissions, so they're living a healthy lifestyle, and they are some kind of ideals and paragons for us. So when we look at our scans, we need to understand what should I do in order to look like that without filter. What else? You see, in this case, we have standalone splashes like this on one hand. On another hand, you see the right ring, the left ring. We see also this on the left kidney, on the right, on the adrenals, on the liver sectors. See the standalone splashes at the upper respiratory system. Here we see excessive, very intense emission on the mammary glands and respiratory system sector, this area for women. And lower back, you see the gap. Well, if I didn't know what exactly is going on with this person, with seeing so many abnormal emissions, I would say that you should go and check with your doctor to go to the hospital for inspection. But just keep it in mind that for women during the menstruation, this is a normal picture. Well, I wouldn't say that it's ideal. I would say that it's normal to see such pictures. So these areas, lower back, the urogenital sector, the liver and kidneys, because they're filtering everything, and the mammary gland sectors, they have hyper functioning, and they can show these abnormal patterns. So it just doesn't make a lot of sense in scanning women during these days, and you have to inform every client before doing this scan on the BioWell. You have to ask for your female patients if they have periods. What else? One of examples of visual analysis, again, here, by looking at this scan, we can see a lot of stress patterns for the person. Some patterns are quite good, normal, homogeneous. Some are just torn into pieces just because of the papillary lines, fingerprints. But, well, looking at it and applying the relative approach, we can see that there is a sector, it's a small one here, you see? It's with the breakthrough. You just right-click to zoom in. You can see this. So this is the right kidney. Well, this person was quite mindful person. And when I had done these scans and I have told him, well, from all I see, the only thing that I am suspicious about, you may go and check your right kidney, what's going on there. Well, and this person was quite mindful. Almost within a couple of days, he has gone to a doctor and made ultrasound scan, X-ray scan, etc. And they have found stones in that kidney. They have found that there is a contraction in the urinary tract in the right side. So he has passed some physiotherapy to not wait till the inflammation to happen, and he was very happy about that. But, well, I have also cases in my practice when I recommend people, you better check this, maybe something is wrong there, and they have to say that, oh, they don't have time, maybe some other life. And yeah, after some time, they call me and say, you were right, there were stones in that kidney, for example, and now I'm in the hospital with inflammation. Yeah, so it's always up to the person to take preventive steps or not, and to wait till the 5th and 6th stage of illness development, or to do detoxification, cleansing procedures, etc. So the visual analysis is about this, looking for these kind of abnormal patterns. And the task for you, look at your scans, scan yourself, scan maybe your friend or some of your relatives whom you can find right now during the class, and make several scans according to procedure. And you can take the scan right after exercises, as we discussed the normal procedure of scanning, and look for the most ugly from the point of view of visual analysis, abnormal emission from all 10 fingers, and try to find which of the emissions in this table of Atlas in here is the closest to what you have found on the scan of that person. So this is the home task for this lesson for all of you. This is the concept of the visual analysis. Maybe it looks like I didn't show too many cases, but actually in the beginning you will have to have these atlas of images printed near your working place with the BioWell, and each time you do the scan you consult there and see this is number 9, this is number 4, it's more like number 5, etc. So the main skill that you need to develop is to distinguish normal pattern from stress patterns that are temporary and abnormal patterns that are not temporary. Usually they do not disappear because of repeating the scans. There are exceptions from this rule, and I will show you one case from this visual interpretation, and when I was not able to reproducibly get the same pattern while I was repeating the scan. So here is this case. If we look at this measurement, we can see that there are abnormal patterns at the lower back of this person. There are some breakthroughs there and excessive emission too. But the most abnormal emission can be seen here. You see this breakthrough, and it's better seen on the finger tab here. You can see this scar here, the breakthrough. So maybe the blue line is not ideally positioned, but more or less it's understandable where it is. It's more related to number 3. And if we look at the names, this is the mammary gland and respiratory system. So this person had a fever at that moment, and this woman was breastfeeding at that moment. And she didn't understand why she has this too high temperature fever, and she was trying to understand it. I was trying to understand it with the use of the biowell to see the correlation. So I have done the scan, and I found that there is the only big abnormal emission with the breakthrough that can be related to the fever is this one, the left mammary gland. So I was thinking maybe this is because of the inflammation that she's breastfeeding, and I have done the finger mode scan in order to see the reproducibility. And unfortunately, as I was saying, the visual analysis didn't help me in this case, because when I was repeating the scan, I didn't see the same breakthrough, same gap as I have seen on the first scan. Initially here, that was quite obvious. I was not able to reproduce it anymore. So maybe the person's health and adaptability reserves are quite high, and she was able to hide and compensate the problem, so I couldn't see it anymore. But anyway, I have sent this person for an ultrasound scan, and the ultrasound scan has proved that there was a contraction of the milk tract in her left breasts, and well, the biowell scan was correct, even though I was not able to reproduce it due to some reasons. Maybe the person was strong enough to hide and compensate everything. So this is the essence of the visual analysis. You have to practice. The more scans you make, the more people you scan, better you will understand the principles of the visual analysis, and you will start seeing the difference between the stress patterns, that is temporary, those breakthroughs like stress patterns, and these abnormal patterns, so you pay more attention to it and drag attention of the person to those spheres. Thank you for watching. You have your home task. Go for it, do it, and share those scans with us. If you want me to send that ideal case, also send me your login name. Thank you. See you in the next lesson.